Good evening and thanks for joining us, everyone. I'm Cherise Gibson.
And I'm Katie Moore. Today, the New Orleans City Council took action to track the delay of care when it comes to drugs used for abortions and other women's health problems. In about 2 weeks, mifepristone and misoprostol will be categorized as controlled substances.
Well, the City Council approved a study into the state's new law. With so much talk about these drugs, we wanted to look into how these drugs are used and for what.
Alyssa Curtis has more from a doctor.
Medications mifepristone and misoprostol have become the topic of heated discussions. But what exactly do they do? While the two drugs are used for abortions, New Orleans Health Director Dr. Jennifer Avegno says they're also used for other health issues.
Prevention of stomach ulcers, for an endocrine disorder known as Cushing's disease, and for some rheumatoid arthritis treatment.
And miscarriages.
It's been shown to decrease the length of time it takes to complete that miscarriage. It's been shown also to decrease the number of people that end up having surgery for the miscarriage.
And to help with hemorrhaging after someone gives birth.
It's very easy to administer. It works quickly. It is not contraindicated in things like hypertension or asthma.
So can a delay in access to these medications really make that big of a difference? Avegno says yes.
One of the formative patients of my medical experience was as a third-year medical student, was a woman who was hemorrhaging postpartum. And I watched the color drain out of her face within seconds to minutes because there was a difficulty in accessing a different medication for different reasons. So it really is the difference between not only life and death, but also you having complications from that pregnancy.
Avegno says right now these drugs are usually held in a cart in every patient's room. But where will it be come October 1st? That's where things get uncertain. New Orleans Dr. Avegno says under new legislation, the drugs will likely have to be down the hall in a locked cabinet, per regulations that cover controlled substances. The guidance on new legislation uses the word secure. But Attorney General Liz Murrill says there is clear Louisiana Department of Health and Louisiana Board of Pharmacy guidance and says as long as it's secure, it can remain in a crash cart. Alyssa Curtis, WWL Louisiana.
And we did reach out to the Louisiana Department of Health and are waiting to hear back. We have also reached out to the State Board of Medical Examiners and the Louisiana Hospital Association, who both declined to comment.